Welcome to the Uprise EHR series Subspecialty Care. This tutorial is for contact lens care. Hi, I'm Kim Castleberry, and I helped design the Uprise EHR for high-level contact lens care that represents the workflow of most contact lens care providers. I think the best place to start is up here at What and When with the exam type. You can pick an exam type that respects the workflow of your particular practice. And in fact, you'll see here, I've got, for my practice, designed comprehensive and contact lens exams for both new and established. I have a contact lens evaluation and management exam type, contact lens progress exam type, and a contact lens dispense exam type. You can see here in the comprehensive contact lens new that we have selected our groups that we want to display for this exam type. Chief complaints, lifestyle, all the way down through and including coding. And in fact, if we jump down to coding, we can see here that we've got a 92004, a comprehensive exam with the refraction broken out for VSP, and then we have the contact lens code here, and we can see here the patient's also elected to do an Optimap. Now, I think it probably serves to look at some of the other contact lens exam types really quick, so you can see how you may want to set up the contact lens types for your practice. Now, it's going to come shipped to you with these contact lens types that you see here, and you can edit them to to respect the workflow in your particular practice. But again, you can see here, again, we've got a comprehensive contact lens for both new and established, and we've got a contact lens evaluation and management. So if a patient has already had their eye exam for glasses, their comprehensive exam, and they want to come in just for a contact lens evaluation and management, that's what this includes. And it includes all of the groups that we would need for a contact lens evaluation and management fit, down to and including the coding. And you can see here that we've defaulted a 92310 level 1 code, and this in my practice for simple spheres, and we have other levels that you can also change it to for torics, for multifocals, and however you have your fee schedule set up. Now, let's also look at what a contact lens progress or follow-up template looks like. And again, we've got chief complaints, other tests, keratometry, refraction, orders, and you'll see here we don't have any coding associated with this visit, so that no invoice is generated to have to deal with. And this is for no charge contact lens follow-ups. Also, similarly, we have our contact lens dispense set up here with just a chief complaint, the refraction, and again, no coding, so that we don't generate any invoices here. So let's go back and look at how we would do a comprehensive new contact lens exam. Again, we've got our technician here, and we've got our chief complaint with plenty of chief complaints that support contact lens care with contact lenses dry, and uncomfortable at the end of the day. And then again, this is a user-defined list. Again, all these items are going to be in your setup, and you can add or delete and select as favorites as you would choose. And again, you've got the typical HPI selection tools associated with all of these chief complaints. We also support contact lens specialty care with PFSH. And you can see here that we've got cornea problems, dry eye, allergy, those kinds of things. And we go down to here, you can see that we can select yes, and we can put that they have a soft contact lens and RGP history. And with lifestyle, we also support the contact lens lifestyle history. So with contact lens questions for in here. And again, do you wear contact lenses, yes or no? If they select no, it says, do you want to wear contact lenses, yes or no? So again, this can be filled out here during the exam, or it can be filled out on the patient portal online. And of course, 3 days before the patient appointments, they're going to be getting a link to fill these things out at their own discretion. We also have allergies and medication support, and we have our vitals here and our screening procedures. So for instance, here we've done wavefront, and we've made a notation that we've got asymmetric astigmatism, and we've got corneal topography here with asymmetric bow tie astigmatism. You get those comments in here just by putting them right in here. And if you want to upload any associated images, you would just do that right here. And we've got some tear testing and vital dyes. If you want to add other tests here, you can add other tests here. And same thing for screening procedures. If you want to add other tests, again, these are predefined screening options that you can select. And these are user-defined options that you can also put additional contact lens tests for that may not be included in screening procedures or in the physical exam or in procedures or special testing. We've got our keratometry findings here. Make any notes that you want to down here. And we have our refraction here. Now you'll notice you can get your device data. So if you have integrated equipment here with keratometry, manifest, wavefront, you can see all of the items here will be displaying here. You simply select the items that you want to import and it will bring them right into refraction here. Now the exams always take the last final prescriptions and make them this year's or this exam's presenting prescriptions for both spectacle and contact lenses. And we can see here that this patient in their last exams, they had a final prescription of this. And we've got the auto refraction right here. And of course we have binocular vision support. We have physical exam support, the assessment plan, procedures, special testing, and orders. Patient counseling to include contact lens items that you can select from Rendia right here. And of course the coding as we discussed earlier. So now let's look at this patient in terms of prescribing soft contact lenses. So when we've got a new contact lens and comprehensive exam that needs a prescription for that and glasses, and we've got the contact lenses drying out, being burny and scratchy, and we've got itching with and without contact lenses. We've got a patient history of allergies and dry eye. We have a family ocular history here. Patient has asthma and allergies. And we have, she wears her contact lenses most of the time. Here's her hobbies and activities. Again, she's allergic to grass pollens, and she's on an inhaler and Allegra. So we can see all of the vitals here. She's pretty nearsighted. And we can take a look at the screening procedures here. We've got optomaps, wavefronts, corneal topography, all right here. And we've got tear breakup times that are normal, tear prisms that are normal, and no staining. So she's been wearing soft torics for 2 weeks at a time. Let's bring it up here and see what she really has been doing. So we can see here that, in fact, she's been using them on a daily wear basis. It looks like overwearing them a little bit on a monthly basis with Renew. So based on that information, I think we can put her in an AccuView Oasis Toric. So we've already got the manifest refraction done and finalized for prescription. Now there's many different ways that you could do the contact lens fit here, but in this case, I think the good workflow is to take the manifest and we can copy that to a contact lens trial. And we can see that we've got the refraction in here, and let's choose a soft toric. That's going to narrow our choices down to products that are in that category. So we want to do an AccuView Oasis 1 day for astigmatism. We'll select that, and we'll move that also to the left eye. And all we need to do is go in and put in an axis in here. So again, we can go check, put these contact lenses on the patient, put their acuities in here. We can go ahead and check the fit. The centration movement and alignment is good, and it is going 5 nasal on the right and 5 temporal on the left. And we've got an over refraction of 0. We want to prescribe these on a daily wear basis, and we can copy that RX to a final. And we can go ahead and authorize a quantity of 12. This one only comes in 30 packs. And we've got our products here, and it's ready to go. So we just hit done. And we're done with the contact lenses. We can print the prescriptions out here, or we can go ahead and move everything over to the invoice so that both lab orders and invoicing can be done. All we need to do is check a primary diagnosis, myopia, and we've got the exam that's billed to VSP with myopia, the refraction, the same thing, and a contact lens exam. And we know that the default is level 1 because that's what I put in the template. Because this is a toric, I want to bill it out at a little additional fee at a level 2. And that will take it. Once we sign the document, it will push the prescription, both the prescription and the coding data over to the invoice and lab orders so that lab orders can be written and that data can be then invoiced. We just sign the document and we're done. So let's look at this same patient, only fitting them in gas permeable, scleral, or hybrid options. Uprise EHR does support all of those, so let's look at how that works. We can again go to the vitals and we see here our pupil sizes are going to be adequate for gas permeable contact lenses or even hybrids and certainly sclerals. And we've got our optimaps here. We've got our wavefront images here. We've got our corneal topography here, our tear breakup time, tear test, and vital dyes here. Of course, we can take a quick look at our keratometry here. And that's based on this, let's just fit them in a standard gas permeable lens option. So again, we can simply go to the plus sign here and we can do another contact lens trial. And let's say we want to fit this patient in a simple rigid sphere. So it's going to give us products that are available for that. And in the configurations, we've loaded the different options for different materials right here. So we're looking for rigid sphere contact lenses. And let's say that I want to do that in a Boston ES design. We can see here that Boston ES is a fluorosilicone acrylate and it's got a 18 DK. Let's go find the rigid sphere in a Boston ES, and here it is right here. We can also see that our other options have much data available for them too. Again, the Floci is a fluorosilicone lens that's got a 26 DKT, 24 wetting angle, and a specific gravity of 1.12. So I think I'll do that one. I think that looks really good for this patient, so I'll select that. And we can go ahead and put our base curve in here. Let's say a 7.5. We've already seen our pupil diameters. So let's go with a 9.0 lens here. And let's go with a minus 250 lens here. And we like that fit on the right eye, so we can just move it to the left eye. And again, 7.5, 9.0, and a minus 2.50. And this is going to be a general purpose prescription. And again, the centration is centered. The movement is normal. And we have an alignment fit, or you can select all of them all at once. We're going to put these trials on and over refract them. And we've got a plus a quarter in the right eye, a minus a quarter in the left eye for 20/20 vision. And we're going to be prescribing this for daily wear and an annual replacement, and we're going to be prescribing Boston Advance. So if we like this fit, let's say we want to do dot the right lens, we want to plasma coat both of these, and we can make notes about whether we want to order warranted or non-warranted down in here. And we can copy this to the contact lens RX final. It'll take the over refraction and compensate for that in the final sphere for our final prescription. This is the data you can see here. Their spheres have been corrected. This is the data that's going to be pushed to the practice management side so that once a lab order is completed, the lab order can be placed and invoices can be done. Now, let's look at how we might do other options just to see how they look. Again, if we wanted to do a rigid toric, we could go down here and look at our options. We could do a bitoric, and we can go in here and again find a material. Let's say we want to do it in Boston 2, and we would put both of our base curves in here, our diameter, and both of our spheres. And as you can see, we have plenty of fields to describe exactly what we want for this lens for all categories all the way through here, whether it's front toric, back toric, bitoric, asphere, scleral, multifocals for spheres, torics, and bitorics. All of these things, all of these contact lens types will have all the fields necessary to order these things. And here's the bitoric fields. here is, let's just take a look at the rest of them. So we've got a rigid aspheric. So here's the rigid aspheric fields. So we can put an aspheric value in here. We can see the rigid multifocal spheres. So we've got all the fields, including add, prism, edge, seg height, seg width, blends. We've got rigid multifocal toric. So we've got spheres, cylinder, axis, all the peripheral curves, base curves. We've got even aspheric values, edges, prism, adds, seg height, seg width, blends, plasma coating, and so forth. And we even have support for hybrid contact lenses. So let's do a hybrid sphere, and we can go select from the Synergize catalog, and let's say we want to put this patient in a Duet HD. We can select a base curve and a skirt curve, and let's do a hybrid multifocal for the other eye. And again, we can go search for the products in the catalog. And let's use a Duet multifocal. And we're ready to go. So you can see here we have full support for all contact lens subcategories with full field support for each one of these lens types. Again, I think you can find this is the first in the industry, and it really does provide excellent support for contact lens subspecialists. Before we go, let's look at a couple of more options. Let's look at the rigid scleral. We do have fields for rigid sclerals, and we have even fields for custom soft contact lenses with pretty much any parameter that you would need for a custom soft contact lens. And we even have soft multifocal toric support for things like the Cooper astigmatism correcting multifocals and others. So again, something you won't really see with any other supplier or vendor as far as EHRs go, and I think you'll find it to be the most complete contact lens section available. That is a wrap for the contact lens tutorial in the EHR subspecialties. I hope you enjoyed it, and feel free to contact me. I'll leave my email address here for you, and see you next time.